Assalamu alaikum, good afternoon, or good morning, depending on where you are. Welcome today to our webinar, which is titled Research Highlights from Across Pakistan. This webinar is being organized by Shaukat Khana Memorial Cancer Hospital and Research Center and the Global Health Network Asia. I would like to thank all the attendees, my speakers, and the Global Health Network team who are primarily behind the scenes, but they have provided all the support in putting this webinar together. My name is Farah Asif. I work in Clinical Research Office in Shaukat Khana Memorial Cancer Hospital and Research Center. I'm a Knowledge Exchange Coordinator at the Global Health Network Pakistan, whereas the Global Health Network Pakistan has its coordination center based at Shaukat Khana Memorial Cancer Hospital and Research Center. Shaukat Khana Memorial Cancer Hospital and Research Center is a network of non-profit, state-of-the-art cancer and research centers based in Pakistan. The Global Health Network Pakistan is a space for healthcare professionals in Pakistan to interact, collaborate, and train. Today, I have invited researchers from across Pakistan who have led or continue to lead research efforts in Pakistan to present their work with us. In particular, we will hear from our panelists about the initiatives on which they or their teams have worked or are currently working. This will help us look at the strengths of clinical research in Pakistan. And we will also find opportunities to learn about the challenges that we encounter when we are doing clinical research in Pakistan. To talk about this, we have invited speakers who will make brief presentations. Uh, a 20-minute slot has been dedicated to each speaker. And following that, we would have a question and answer session before we close the session. As we continue with the presentations, please keep noting your questions. For questions, I suggest all of you to use question and answer function of the Zoom that you would see at the bottom of your screen. Please, when you write your question or comment, briefly introduce yourself with your name, role, and affiliation if possible. I would suggest that you can use the chat function to generally introduce yourself, or if you would like to draw our attention towards any technical issue that you face. And I hope that my team would get in touch with you directly and help you fix the issue. This webinar is being recorded and we will be posted on the Global Health Network platform for reference or to enable viewing this webinar at a later date or to share with the participants who were unable to join the session right now. So we're going to make a start now. And before I would like to invite our speakers, I would like to just show some data of the registered participants for today's webinar. So I would like to thank the Global Health Network team. They have pulled out this data. So we have a total of 484 registrations from today. As expected and anticipated, most of the registrations are from Pakistan, and we have a total of 232 registrations from within Pakistan. Then it is good to see that we have registrations from Kenya, Nigeria, Tanzania, UK, Ethiopia, Zambia, Uganda, Cameroon, US, Zimbabwe, India, Rwanda, Australia, Malawi, Nepal, Congo, Ghana, Bangladesh, and Germany. And this is just so heartening to see that we have a global representation among the attendees today. Right now, we are joined by more than 100 attendees. So I would like to again thanks all of my attendees and of course my speakers. So with this, I would like to start. So on the screen, you can have a look at the agenda for today. And we have aligned the speakers and you can see the titles of their talks for today on the present screen. So I would like to invite my first speaker for today, and that is Dr. Babar Khan. And Dr. Babar Khan would be presenting Pakistan as an emerging market for clinical trials. So brief introduction of Dr. Babar Khan. Dr. Babar Khan is founding president of ACRP Ambassadors Club of Pakistan. He is Director, Clinical Trials Unit of National University of Medical Sciences. He is National Consultant for WHO project of developing National Framework of Patient Safety and Quality of Care. He has conducted 72 clinical trials as investigator under regulation of FDA in US. He is certified principal investigator from ACRP and a fellow of American Physicians of Clinical Research. He is active participant of promoting clinical research initiative nationally and internationally. And I hope that as he would, during his presentation, we would have the opportunity to look at the efforts and the ongoing work that he has been doing to, put together Pakistan as a emerging site for clinical research as well as clinical trials. So over to you, Dr. Babar. Thank you.
Well, I mean, very detailed introduction, Farah. Thank you very much. I mean, the simplest introduction is an old person who still wants to justify his existence, and that's it. And then trying to contribute in whatever way I can. Farah Asif, thank you very much for putting this effort to keeping people together and then trying to have some real good information passed on to the people who are interested in clinical research. And thank to Louis Stanley. I mean, you're coordinating this effortlessly, and then you really did a remarkable job, and the team of the Global Health Network. Well, my talks, I will be having a cursory glance on a global picture, because that is going to be taken care of by other participants. And then I'll just touch on the clinical trial, how things are happening in Pakistan. But my main focus would be on Pakistan as a potential hub for clinical research. So that is what I'm going to predominantly be discussing. We all know that pretty much, I mean, research, clinical trials, they are the research studies, and that is being conducted on human subjects. Either we do some observation or we do some interventions, and the related biomedical and behavioral outcomes is what we looked into. This is just to remind, because all of us are clinical researchers who are participating in this webinar. But I mean, physically you are at some place, but mentally you have to bring people together. So that's why I just wanted to share with this definition as envisaged by the NIH. When we look at the clinical trial, we see, I've been to many places where clinical trials are happening. But what I see is that anybody who is contributing towards clinical trials in whatever capacity is concerned with their job description only. They're not able to comprehend the effects and the power of clinical trials, which is doing a lot more than simple things which we do in our clinical trial units. How it's doing it? We see that participants are empowered. I mean, of those 72 trials which I conducted, there were some of them were very high enrolling, and then some of them were, having less number of patients. But I observed this very, very keenly, that a patient, when is part of a trial, is keen to learn more about his disease, is keen to learn more about the way we can tackle that particular disease which he or she is suffering from. So the whole idea is to empower the participant, and that is actually the whole objective of the health promotion initiatives like IUHP and others. So that is one big thing which clinical trials deliver. Then, of course, I mean, we get access to the innovative treatments. I mean, we all know that new things are coming up, be that a diagnostic, or be that biological, or be that an investigational medicinal product or molecule. I mean, we are with these clinical trials, we're getting more and more and better access to the innovative treatments. And then those who are registered in the clinical trials, they are specialized people then, because they are privileged people. They have 24-hour access to the investigator and to the doctors, and their safety profile, the assessment of safety profile is much higher. So they are having the specialized medical care. Then, of course, once we enhance the treatment modalities, then we improve the disease prognosis. We delay the complication. We delay the fatality as a result of that particular disease the patient is suffering from. So we improve the disease prognosis. And of course, we are generating medical knowledge, which is huge, and that is going to be good to go a long way in making humanity, be relieved of those diseases. And of course, then we in clinical trials we get an opportunity to refine the clinical guidelines. I do remember, I mean, there are some definite guidelines, but when I used to attend the investigative meetings, we used to see that, I mean, there were standard of cares, and people do talk about altering, changing, modifying, and making the clinical guidelines improve and refine them. So that is another advantage of clinical trials. Then, of course, the outcome, when you know the biomarkers better, when you know the tracking of the treatment better, then of course you can predict the outcomes better. So, and of course, once a team is engaged in research, that enhances the capabilities to and the focus towards research, then that basically gives a lot of advantage in all the other medical and system and other research too. So these are the added advantages of this clinical trial, which we do have. Now, this is what the extra benefits we do have about. It's again. All right. So now let's discuss about the global scenario. We do see a surge. This clinical research industry is growing at a consistent rate of 6 to 8% annually, and 60 close to $60 billion is a pretty good size for any industry. This is what the clinical research industry is right now. And it's constantly growing, and it is expected to grow and reach cross 100 billion mark by 2030 or more. So we see a good trend of growth in clinical research, specifically if you look into the Western Pacific and the Southeast Asian regions. There are climbs, and there are this bubble in 1920 and 21 is because of the global pandemic of the COVID, and that we had lots of problems with the COVID, but that actually paved way for the development of clinical research initiatives too. So by and large, we see lots of research is happening now, and it's with the passage of time, it's constantly getting better and better. If we discuss individual countries, I mean, so I spent good part of my life there at US, and big number of clinical trials happening there. That's still the leading country, which is of course 50 states, but that's the leading country in clinical trials. But China is catching up pretty fast, and then it appears that probably they might be surpassing because of the big population size. India is also catching up. But the important point to share here is that in those top 20 nations, we don't have Pakistan. Though it's the fifth largest country in terms of population size in the world, but that is lagging behind in terms of things. We have two authentic sources from where we can get the information about the clinical trials: the clinicaltrial.gov and the WHO International Clinical Trial Registry Platform, ICTRP. Both indicate the same, which we just shared in the previous slide, that there is for sure a climb in the number of trials. If you see from 2000 to 2024, from couple of thousand to seven hundreds of thousands clinical trials are happening. So this is something which is constantly happening because there's more and more information, more and more knowledge, so more and more trials, newer diseases, newer treatment modalities, so more clinical trials. Pakistan is also, if we look here, Pakistan is also did pretty good in last 10 years, 10, 12 years. And the climb again was in the COVID, where we enrolled thousands of patients in different clinical trials for the vaccine, specifically vaccine for the treatment of the COVID and prevention of COVID. To my pleasant surprise, I see a good number of trials are happening in the region, especially Iran and Egypt. They're doing pretty good. I mean, a good number, 34,000 plus clinical trials in Iran. So it's picking up. Now, the main part of my presentation, that how and why we are promoting Pakistan to be a hub of clinical trials. If you look at the demographics, I mean, fifth largest country in the world, and the population growth rate is close to 2%, which is one of the highest in the world. So that is one important reason. Then the genetic diversity. I mean, you can find people with the wheatish complexion, dark complexion, fair complexion. You will see, if you have any knowledge of anthropology, you will see all kinds of sharp nose, lifted nose, saddle nose, all kind of nose there. Meaning that the genetic diversity you see in the Baloch and the KPK Pakhtun, then the Punjab and the Sindh, and of course the northern areas. There is again similar kind of diversity in the racial and ethnic, groups as well. If we want to investigate any investigational medicinal product, we prefer to have a diverse population in our group, so that we can boast that probably this investigational medicinal product is doing good for almost everybody. Then the genetic disorders. Here, the tendency in Pakistan is that of the consanguineous marriages, and there are other predisposing factors as well. So the prevalence of genetic disorders, which is again a huge area for clinical research and clinical trials, that is there. And of course, the diverse environmental and lifestyle factors. If you see in Siachen, the ice never melts. It's snow top, snow capped. Those mountains throughout the year. And if you see, go to the deserts of Thar, the temperature climbs as hard as 47, 48 degrees Celsius. So a range of temperature, a range of environment, and a range of ethnicity, a range of genetic diversity, that is what basically are crucial points which are required for any place to be the hub. Another important point is the triple burden of the disease. I mean, if we see that communicable diseases, Pakistan, now if you look at the hepatitis C and tuberculosis, in hepatitis C, almost 16 to 17% of the total hepatitis patient in the world are from Pakistan, which constitute a little over 2% of the total population of the world. So the per unit population, the prevalence of hepatitis C is highest in Pakistan. Similar is the case with the non-communicable diseases. If you go and look at the hypertension, ischemic heart disease, and especially metabolic and endocrine like diabetes, the recent published International Diabetes Federation Atlas declared that almost every fourth individual in Pakistan above the age of 25 years is glucose intolerant. So no matter if it's a communicable disease, if it's a non-communicable disease, even the traumatology, if you go to the injuries, we have seen the surge of injuries in last 10, 20 years. It's 50% rise because of the disturbed infrastructure and lots of traffic and little disorganized traffic. We see lots of accidents and injuries. So this triple burden of disease is again something which is important for any country to be the hub of the clinical research initiatives. I remember whenever we used to see the patients for the enrollment in any clinical trial, we try to look for the treatment naive patients, because there is a clear baseline with these patients. If they're not having any kind of treatment, then you reduce the risk of drug interaction as well, because there are not many drugs there, so no drug interactions. And many of the when you look at the eligibility criteria for inclusion into the trials, the exclusion criterias are many a time having lots of drugs. So if the person is taking multiple, concomitant medicine, then he or she may be excluded from the study because of those exclusions. And then, of course, the higher response rate, because these participants, they manifest much better than those who are having concomitant illnesses and concomitant medication they're taking. So treatment naive patients are pretty much available here in Pakistan. That is another very good and important aspect if we want to look at the ability of a patient to get registered in the clinical trials. The healthcare sector in Pakistan is getting better and better. You will be surprised. Many of you may be surprised that we are now having institutions which are Joint Commission International JCI certified, and they're touching the highest standards of healthcare delivery. And there is a growth of some new institutions as well which are coming up. Same is with the human resource and the other resources. As far as if we look at the number of trials, I've already shared that with you in the earlier slides. A good number of clinical trials are happening. Even now, the active clinical trials are 64, which is right now, which is happening. The DRAP, the Drug Regulatory Authority of Pakistan, have already approved over 100 clinical research sites for conducting the clinical trial, though they have very stringent criteria in terms of physical infrastructure, in terms of equipment necessity, in terms of human resource. All those criteria are met, only then they approve the site to conduct clinical trials. And still we have 100 plus clinical trial sites in Pakistan, and 23 clinical research organizations, CROs, which bring trials through sponsors to the sites. So a good number of multinational as well as national clinical research organizations, CROs as well. They have approved 5 bioanalytical laboratories as well. So things are growing pretty well. In my institution, if I say that we are planning to have a customized building which will be doing only research, we will be having bioavailability, bioequivalence, and phase 1 setup at one place, and phase 2, 3, and 4 at another place, and phase 2, 3, 4 at another place in just one university. And in one city, we'll be having 3 CTUs in 2025. We already have one. Second one is going to be. So the whole idea is of explaining is that, I mean, lot of good activity is happening and a lot of infrastructure is being made and developed and ready to welcome the clinical trials. This is reflecting the placement of different clinical trial units in Pakistan. Predominantly, they are in the populous provinces of Punjab and in Sindh, but we do have national representation, and they are pretty much spread all over Pakistan, those 100 plus clinical trial units. We have trained human resource, over 200,000 doctors, over 100,000 nurses, though still we are far from the required ratio of 4 plus for the healthcare providers per thousand population, but we are reaching there. So human resources also, getting better and better. Then many institutions are focusing on clinical trial trainings as well, and they're conducting different certification and even degree courses as well. If we look at the professional development perspective, then I'm pleased to announce that there are only 2 countries in the world which are having ACRP Ambassadors Club status, and Pakistan is one of them. Japan and Pakistan are the only 2 countries which are having ACRP, and ACRP is the premier body which is doing a great professional development job by conducting their certification programs for CCRC, CCRPs, CCR, and now even the fellowships, CPIs, Certified Principal Investigator. So this is how the professional development is getting better and better, and the regulatory process also streamlined pretty good, and we are having some good international collaborations as well. Currently, we are doing good in having the researchers, number of researchers. 5,000 plus researchers are there, and there the FELTP, that has joined hands with Ministry of Health, and along with the CDC and NIH. And the clinical trial, our draft basically require two approvals, one from the central IRB, which is basically the National Bioethics Committee, and of course from the clinical trial committee of the draft, the Drug Regulatory Authority of Pakistan. Cost is very important factor whenever we're talking about the conduct of the trial. And if you go to the individual, the human resource, the facility cost, the patient recruitment cost, regulatory fee, no matter whatever parameter you want to check, operational expenses, even the medicine conmeds and those kind of things, that is all as compared to the other parts of the world. It's very cheap as compared to the other parts, even in the region. And there could be some local partnerships as well, because the institutions are ready to chip in with their things while we are going for that. I remember whenever we used to conduct clinical trials, all the sponsors were very keen to reduce the enrollment timeline to the shortest. And when we have all the factors which I have just mentioned, less cost and more availability of the patients, eligible patients, then that is going to give fast recruitment. And with that fast recruitment, of course, the less number of days required to complete the clinical trial. So all these factors, then there's some few collaborations as well. WHO is focusing here in Pakistan. I would mention here that the big summit, which clinical trial summit of Pakistan, which we are holding in the month of February, that is going to have one whole session with the WHO, and team is coming from the headquarter and the region as well to promote clinical big time clinical trials in Pakistan, randomized clinical trials in Pakistan. All the kind of sponsors, the institutions and the pharma and the other sponsors, they're also part of the effort which we are collaborating in making clinical trial hub for the Pakistan. Well, this with this, I stop sharing my slides, and I would be looking forward to have a further augmentation of the initiatives which the global network is taking to make clinical research a household and a common phenomena at the places. Thank you very much.
Thank you, Dr. Babar, for a very comprehensive overview of clinical research and clinical trials in Pakistan. I would thank you for showcasing the strengths that we have, that makes Pakistan an attractive hub site for doing clinical trials as well as clinical research. It was heartening when you shared how the funding from international collaborators and international organizations is being flowing into the region to promote clinical research and clinical trials in the region. I have few questions with you, but we are following a format today that we would first cover all the presentations, and we have reserved some time for question and answer at the end. So we would be, of course, coming to all the speakers, and we have some questions that I've taken a note for Dr. Babar Khan as well. So, but I would like to move to our second presenter. And our second presenter for today is Dr. Ayesha Humayun. Dr. Ayesha is the principal of Sheikh Khalifa bin Zayed Al Nahyan Medical College, Lahore, head of Public Health and Community Medicine Department, and director CTU at Sheikh Zayed PGMI, Lahore. She is a fellow of College of Physicians and Surgeons Pakistan and PhD Community Medicine. Dr. Ayesha is a senior instructor, supervisor, mentor, examiner, and evaluator of PhD, MPhil, MPH, and in many universities. She has supervised 7 PhDs and many MPhil and MPH scholars and has a keen interest in nutritional epidemiology, epidemiological methods, reproductive health, epidemiology of non-communicable and communicable diseases, qualitative research, healthcare quality, and safety. And she would also give a brief introduction of some of her achievements in her talk as well. So for Dr. Ayesha, we would be playing her pre-recorded uh, presentation today. She is with us and she would be happy to take any questions for her. So right now, I would ask my support team to kindly play Dr. Ayesha Humayun's pre-recorded uh, presentation. Thank you.
Hello everyone, I'm Professor Ayesha Humayun. I'm going to present the situational analysis of clinical trials in Pakistan, and I'm grateful to Dr. Farah Asif, Head of Clinical Research Office in Sheikh Shaukat Khanum Memorial Cancer Hospital and Research Center, and I'm immensely grateful to Mr. Louis Stanley, Webinars and Workshops Coordinator at the Global Health Network, Oxford University. So let's start with the presentation. Just a brief bio about myself. I'm FCPS and PhD, fellow of IFI, International Female Institute at Philadelphia, and with H index of 33 and more than 122 research publications. And fortunately, I'm among the top 2% scientist list of Stanford University 2023 and in 2024 as well. I'm a GBD collaborator, a TDR grantee, and DARD alumni, and I have been supervising 7 PhDs and examiner and facilitator at multiple universities in Pakistan. Clinical trial registration is very important. When we talk about designing and conducting a trial, the registration is now a mandatory part of that trial. It increases the visibility for international audience, and it also helps while we are submitting the manuscript. So World Health Organization, they have a platform that is International Clinical Trial Registry Platform, ICTRCRP portal, and it actually combines or collects the data from the primary portals, primary sites for clinical trial registration like clinicaltrial.gov. Here you can see the website of clinicaltrial.gov, and here we can have a clear idea according to the country, according to the disease, or according to the funding source. There are multiple options for to extract the data about clinical trials. So I have done some extraction and I will show it in further slides. So starting with the bibliometric analysis that I have done using the PubMed, and bibliometric package of R is used for this. And the term that was used was RCT, randomized controlled trial with Pakistan in all fields. And by the searching RCT on PubMed, I got 1589 published trials. And in last 1 decade or 10 years, there are 1140 published trials. So it shows that the majority of these trials, they are in last 1 decade. And specifically in last 5 years, we can found 767 documents. And these are again more than 2/3 of the total published trials in last decade. So here in this slide, I have shown the bibliometric analysis showing how the affiliations collaborated. The size of the node and the width of the line connecting shows higher number of document produced and collaborated on. So you can see Khan University here and it's collaborating with University of British Columbia, and a more strong collaboration or thick line can be seen with the John Hopkins School of Public Health, with the Jawaharlal Nehru Medical College, and with Liverpool University as well. But a little thinner line with the University of California. But again, there is a collaboration with University of Toronto as well. University of Toronto collaborating with the Dow University of Health Sciences, and Khan University is also collaborating with Dow University of Health Sciences. And in Pakistan, and third university is Rifa International. So you will find these 3 universities in Pakistan which are Mainly the authors are from these universities and they are collaborating. Here you can see the annual scientific production in last 5 years, and in last 1 year you can see a hype in the scientific production. And here there are 3 field plots for first author affiliation on the left, the first author in the name in the middle, and the corresponding author country on the right. This is last 5-year data. We can see Rahman A, and we can have another familiar name, Zulfikar Ali Bhutta over here. These are the top 10 authors and top authors, and these are the primary affiliation. And in this you can find the Aachen University and yeah, mainly the Aachen University. Ripa International is over here. So other universities are not from Pakistan, and here you can see the corresponding author majority are from Pakistan and from USA as well, then India, Canada, United Kingdom, Australia, and Saudi Arabia. So now top 10 sources of publication in last 5 years. You can see 135 publication from the Journal of Pakistan Medical Association, JPMA, and 76 from Ayub Medical College Journal, and it's likewise the 43 from the Journal of College of Physicians and Surgeon, and then the PLOS One Scientific Reports, New England Journal. So you can see the top 3 journals, top 4 journals are from Pakistan. So now showing the cumulative sources growth in last 5 years, you can see the topmost is JPMA, Journal of Pakistan Medical Association, and on the second cumulative resource is from this one is JPMA, and this one the Journal of EU Medical College. So these two are actually on the top. So now looking at the top 10 most published authors in last 5 years, we can see 26 publications are from Rahman A and Salim A, 24, Ahmad A is 23, Khan A 22, and so on. They are very closely lying. So these are highly publishing, clinical trial publishing authors. So it means they are actually conducting clinical trials. So many. And there is Zulfikar Ali Bhutta, and almost all are within difference of 2-3 number. So if you look at this slide, you can see top 20 affiliations of the first authors in last 5 years. 475 authors were from Aachen University, and from McMaster University there were 312 affiliations, and University of Toronto 228. So these publications, their affiliation were of the first author were with these international universities as well. So these top authors, they are actually showing their primary affiliation with Pakistan and their secondary affiliation or the second affiliation with international universities. And again, you can find a few universities from Pakistan over here. Dow is here, and Rifa International and Sheikh Zayed Medical College and Hospital is here. So in this way, you can see how much number is being published that are that covers these 20 affiliations. So top 10 corresponding author country in last 5 years. The blue is single country publication and all authors from one country, while red is multi-country publication. So all other countries, they are majority multi-country publications. Only Canada, there are some single country publications as well. But in Pakistan, we have majority single country publication. That shows that we avoid collaborations, and it means that there is a need that we encourage collaboration and we help them seek collaboration. Thank you. So the next one is the most frequent keywords in last 5 years. In this you can see human, female, male, adult, middle age, and you can see Pakistan in the keywords in 165 trials. So the most frequent word in the title in past 5 years, you can see the trial is the most frequent word 396, while randomized 284, and all the other keywords like randomized and even Pakistan is in 85, in which in the title Pakistan is reflected. So talking about the clinical trial registry, clinicaltrial.gov, And here I found almost 5.5 million clinical trials registered. And from Pakistan, there were 3,807 trials. And among these trials, early phase 1 trial were 37, phase 1 were 90, phase 2 179, phase 3 214, and phase 4 156. So majority of trials were phase 2 or phase 3 or 4. Now, looking for participants, the almost 111 are not yet recruiting, while 635 are recruiting. 2,379 they are completed trials, and 19 trials were terminated. Okay, so looking into the age group, out of 3,807, 1,075 trials were on children and less than 17, birth to 17 years. This age group was used, while the older or geriatric population was taken in 1,400, almost 1,400 trials. So when you look at the funders, that the funding agencies in 27 trials, that was NIH, while in federal agency, other US federal agencies were in 15. And looking at the pharmaceutical industry or other industries, there were 224 trials, while individual universities and organizations, they are sponsoring majority of the studies in Pakistan, and these are 3,629. So looking at the type of disease, these are the most prevalent diseases which I used these terms I used to search the clinical trial registry. And I found 138 cancer trials, 23 tuberculosis, 5 typhoid, 2 dengue, 158 diabetes, 68 hypertension, and 115 heart diseases. So you can see more prevalent diseases are being researched less. Less trials are on the diseases which are highly prevalent in Pakistan. And now how we can interpret this data. Looking at all those bibliometric slides analysis, it shows that the trials, Pakistan is actually not impacting the clinical trial industry, and we have a very little impact. We have very few authors which are actually repeatedly cited, and they are repeatedly authoring the clinical trials, and they are conducting clinical trials. We are less collaborating with other organizations locally as well as internationally, and funding sources are scattered in organization and institute, and we don't have a national level agencies like NIH or any other national level granting agencies for all disciplines to be covered, not just public health. So in our institutes, there are very few who are actually leading ahead, and they are taking clinical trials. Only few authors are highly cited, so that I already have mentioned. So we need to work on that. We need to increase the capacity, and we need to train our young researchers in clinical research, specifically for clinical trials. In Pakistan, we have the population of Pakistan is 235 million, and more than that. We have a huge potential to offer a platform for clinical trials. We have multiple diseases, and some diseases are highly prevalent, like tuberculosis, hepatitis B, C, HIV, and so we need to offer for clinical trials on these diseases as well. Here you can see the challenges. So we have infrastructure and resources challenges. We have inadequate infrastructure, limited funding, and shortage of trained researchers, which hinder the expansion of clinical trials. And we have a difficulty in regulatory environment. In TRAP, it is following the bias study rules of 2017, but we are local clinical trial registries. They are not linked with the WHO list of primary registries, and that affects the international collaboration and recognition as well. So we need to work on the regulatory facilitation, and we have to facilitate our institutes, and we have to develop resources and work on resource sharing as well between developed and developing countries. So the opportunities we have a high disease, we are high disease burden country in many diseases. And I have given the example of these diseases. So we can offer clinical trials, we can, as a clinical trial site over here, and definitely we can be more helpful, and we can in the clinical trial market, seeking international trials, and we can also develop our own local trials and conduct those. Academic institutions like Aachen, Dow University of Health Sciences, and Sharifa International, these are the universities and institutes. They are actually collaborating in clinical medicine. So, by concluding this presentation, I would like to emphasize that while Pakistan's participation in the global clinical trial industry is currently limited, recent growth and the presence of reputable academic institutions indicate potential for expansion. And definitely we can, if we collaborate nationally, we can collaborate more internationally. Addressing challenges related to infrastructure, funding, capacity building, and regulatory frameworks will be crucial for Pakistan to enhance its role in global clinical research. So, as example of this, we in the recent past, many clinical trial units are being established at different medical institutes and research centers, and these are actually their faculty is getting interested in clinical research, and they are, because they have a pool of patients and they were offering their services for international trials. Now they are also planning for their own local trials, and funding is definitely a big issue because even research institutes, they don't have local funding. Grant writing is another thing that need to be that expertise need to be developed. And I being in from Sheikh Zayed Postgraduate Medical Institute in Lahore, Pakistan, in my setup we are all also offering trial training on designing the GCP guidelines, and also the execution and data analysis in clinical trials. And we are also making them familiar with our faculty and in local faculty with regulatory frameworks. So in this way, we all institutions in Pakistan, they can join hands to expand this culture, and they can ensure local collaboration. And in that, through this effort, we can achieve the desired place in clinical trial market internationally. So thank you so much for the patience listening, and your comments, suggestions, and your any queries, they are more than welcome. Thank you so much.
Thank you so much, Dr. Ayesha, for your presentation. I was noticing that Dr. Ayesha was with us for most of the time. She preferred to use a pre-recorded presentation because we were anticipating some problems with her connectivity at her site, and I believe that's again because she just left, so maybe she is facing some issues. So I'm hoping that she would be able to join us in question and answer sessions. So looking forward to have her while the whole panel come together for the question and answer session. And we have, of course, kept the question and answer session at the end of our presentations. So with this, I would like to invite our third and final speaker for today. And our third speaker is Dr. Sadiq Naveed. And Dr. Sadiq Naveed is a psychiatry program director at the Eastern Connecticut Health Network. He serves as an associate professor of psychiatry at the University of Connecticut School of Medicine and Frank H. Natter School of Medicine. He is currently serving as a chair of Association of Physicians of Pakistani Descent of North America, Merit. He completed his school from Nishtar Medical University, Multan, Pakistan, same medical school as mine. Additionally, he completed Masters in Public Health at the Benedictine University. Dr. Naveed completed his general psychiatry residency and child and adolescent psychiatry fellowship. He has published several peer-reviewed articles, book chapters, and presented at national and international conferences. So Dr. Sadiq Naveed would be presenting a report that primarily Apna Merit has worked on. And Dr. Sadiq informed me earlier that he might invite one of his colleague, Dr. Syed Uzair, during his conversation, during his presentation. So I'm going to invite Dr. Sadiq Naveed. And Dr. Sadiq, feel free to invite whenever you would like to invite Dr. Syed Uzair to join and share the stage with you. And please do that and share a brief introduction of him. So with this, I am handing over the stage to you. And yes, over to you, Dr. Sadiq.
Thank you very much. Assalamu alaikum. Good morning to people who are listening other than Pakistan, and good evening to people in Pakistan. It's pretty early for me, so usually in the morning I'm a little crampy in the morning, so I apologize in advance. So, and I have to finish this presentation before my 5-year-old son wakes up. Otherwise, it's going to be a turmoil in the room. Thank you, Shaukat Khan Memorial Hospital and Research Center and the Global Health Network Asia for organizing this activity, a very much activity that is needed in Pakistan. My name is Sadiq Naveed. And it is Sadiq Naveed, but over the year it has become Sadiq Naveed. Chair Apna Merit. I want to preface with this. Dr. Humayun alerted me that some of the content's going to be pretty similar. So I don't want to bore you with numbers, but I will present some of the things that we found out in a research landscape report that was published in 2022. And we are hoping we can publish again pretty soon. So what is Apna Merit? I just want to give you an introduction. So Apna is Association of Pakistani Physicians who are practicing in North America. In Apna has several committees. One of the committees, which is one of the most vibrant committees within Apna, is Apna Merit. We are invested to improve medical education, research, innovation, and transfer of knowledge in back in homeland. And this committee designs courses. In this way, it tries to enhance the medical knowledge. We also like to collaborate with other stakeholders in improving healthcare landscape in Pakistan. One of these subcommittees, which is led by Dr. Syed Uzair, and that's why I just wanted him to be here, because this is his baby, this landscape report. He is leading Merit Research Subcommittee. And as I mentioned, in 2022, we presented a clinical research landscape report in collaboration with some other stakeholders, and I will mention their name and we'll get there. As part of, this Merit Research Landscape Initiative, we are conducting monthly webinars where different speakers such as Dr. Uzair by himself, Dr. Hassani, and other leaders in Apna Merit Research Subcommittee, they join and they talk to stakeholders in Pakistan about the landscape of clinical research in Pakistan, what's going on there, how a certain program is working, and what are the barriers, what are opportunities, and what are strengths of our clinical research environment. And if you are interested, and I can share some of these links later in the chat, you can go onto this YouTube link and you can listen to some of the pre-recorded webinars that we do on monthly basis. And I invite all of you to join those webinars so you can share your perspective and we can all learn together. Next slide. So if you look at the numbers, right now there are about 400,000 clinical trials that are registered across the globe. And this might not be an inclusive number because in some countries, clinical trial registration may not be a requirement. But one thing that I want to point out is since 2016, the clinical trial numbers has almost tripled. Now let's see how much of the clinical trial is happening across the globe when we talk about regions and what share Southeast Asia and South Asia holds. Next slide. Okay, so if you look at, the share of population and share of the trials, and that also reflects in overall economic picture of the country too. North America uh, is 4.8% of the world population, but it makes an enormous contribution to clinical trials, and there are multiple reasons for it. In Europe, the percentage of population is about 10%, and the share of the trials is 28.6%. On the very right, if you see South Asia, which makes 1.7% of 25% of the world population, but the clinical trial contribution is 1.7%. And for Southeast Asia, the number of the percentage of clinical trials is about the same. So when we look at the global picture, there are about 400,000 trials that are happening each year. We are one-fourth of the world population. The South Asia region and Southeast Asia, and Pakistan being one of the top 10 countries in terms of population, we share a very small percentage of the clinical trials. Next slide. These are the clinical trials that have been registered from Pakistan. If you look at, the y-axis in 2021, about 200 trials were registered. In 2020. There were about 300 trials that were registered. And remember, this was the era when COVID was around the world, and a lot of clinical research was happening in the arena of the COVID. Next slide. Next slide. So the previous slide is going to talk about the clinical trials overview, and it's going to talk about the different elements and how are we doing. And that's where I'm going to overlap with Dr. Humayun. So don't want to bore with your numbers. So I will just point out pertinent statistics or numbers, and then I will move on. Next slide. So in terms of clinical trials, so Aachen stands out with 97 clinical trials, and probably a lot of it comes from how much money they invest into and how much resources they invest into developing clinical trials. Dow University Health Sciences is second, is 39, and there's a significant gap that we see, and GSK is at 35. Next slide. Clinical trials by phases. So it is, if you are into the drug development, so there's a difference between phase 1 trial, phase 2, phase 3, and phase 4. We are primarily doing phase 2, phase 3, and phase 4 trial with phase 2 at the top. Next slide. Trials that have been completed so far, 750. And again, I want to reflect on the numbers that I shared earlier, that across the globe, 400,000 trials are being done in 2023 or 2024, and we make on maybe even less than 1% of the world stage. There are 126 trials that are going on, and a lot of some trials have been terminated, some have been withdrawn, and some are ongoing, but they're not recruiting. But these are very small number. But I want you guys to look more onto completed trials and how are we doing compared to the global world. Next slide. Most of the trials that are happening right now, if you look at the top 5, for example, and this was what I was pointing out earlier. So viral infections, coronavirus, and COVID-19, it is leading the table, with pain being the second one. And this is what Dr. Humayun was saying, that we have, heavy burden of the diseases when it comes to the, non-communicable diseases such as diabetes, hypertension, hyperlipidemia, but we are not doing much in that area, actually very little. And, going from my clinical expertise, psychiatry, we did a prevalence study about, 6-7 years ago for depression in child and adolescent population in Pakistan, where we looked into the prevalence for across 7 cities in Pakistan in different provinces, but primarily Punjab and few cities in Sindh. What we found out was the prevalence of depression, for example, is almost similar to US population or Western population, if not more. It was actually more. So we have, patient population that is there that can be recruited, but we are not enough trials are not happening. Next slide. Okay, so clinical trials, the endpoint, so roughly about 418 trials where endpoint was reached, but there is about 80 trials where it was partially achieved, not achieved, or inconclusive. Next slide. So, and I hope I'm saying his name right, Dr. Therma Atom, he designed this country as attractive index for clinical trials, and we do talk about this in our clinical report that we prepared. So I will urge all of you to go back and look at that clinical report if you're really interested. I will share the link in the chat. There are 5 factors that determines the country's attractiveness for clinical trials. One of them is suitable patient pool, and I will not go really into detail of this. I will urge you to read this. But when we look at this suitable patient population, we have heavy burden of diseases. So we have a patient population that exists. There is a percentage of patient population who can who is literate, who can read and write, and so they can be recruited into the trials. And if we know from our patient population that there might not be a lot of investment in clinical trials that would be needed into compensating patients. And we did not have, when we were doing for example, our study, we didn't have any issues getting consent from patients. But while this is a strength of us, it also there are some barriers or some threats that also comes to light, because when they are not familiar to clinical trials, what clinical trials are, and when it means that you have to consent, what does that mean? What kind of questions that you should ask? So there might be some myths that come along the way, so we need to address them. The second point is, and I'm just going to touch base a little bit on all of them, so we can leave time for Dr. Uzair to also speak if he's here. Cost efficiency. So we have a huge human resource. We have people as a sizable percentage of young folks who are in workforce, who are looking for work, and that really cuts down the cost. But at the same time, this workforce may not be skilled enough to handle a clinical trial. So we need to work on enhancing the skill set, but we do have people who can do this sort of work. In regulatory conditions, when it comes to clinical trials industry, and I hope Dr. Babar Khan also spoke about that. So when it comes on the clinical trials, there are laws, but there is not enough development of protocols. And whenever there are regulations, sometimes these regulations are way overboard, and it put a lot of restrictions on the clinical research organization, clinical trial industry to carry out the research. And I briefly touched on the relevant expertise. We do have workforce who is willing to work, but at the same time, this workforce might not be skilled enough. Last thing is infrastructure and environment. In infrastructure part, there are I would say reasonable CRO that exists, but at the same time, and they are willing to work with that. But given the size of the country that we have, these CROs are not comparable to our country size. And at the same time, if you look at the top funders, if I could have gone back on the slide, top funders, top institutions where trials are happening, they are not, except Dow, they are not from public health sector. A lot of it is coming from semi-private or private institutions. So we, as a country, we need to change our direction and policy, and we need to invest into healthcare infrastructure and clinical trials. I'll conclude my presentation here. Sorry, I missed that part. So this is the clinical research landscape that we publish in collaboration with BMY Health. I'll share the link, and Dr. Bushra Anwar from BMY Health. So what she did was she transcribed all those lengthy webinars, and she put all of this into a very conclusive report. It was very comprehensive, but yet it is not an exhaustive document to read. So I will share the link. I urge all of you to go to read. And Dr. Uzair, this was his baby. He came up with the idea. He implemented the idea with the stakeholders like Dr. Hasni. Next slide. I don't want to miss any slide now. Okay, so this is the reference for the report that we publish. I will conclude here. Thank you very much. Thank you for inviting me. I will stay on for the questions, and I don't think we see Dr. Uzair in the chat. Thank you.
Thank you, Dr. Sadiq. Thank you so much for your presentation. And yes, I think we are not joined by Dr. Uzair. So in that case, with the permission of all the speakers, I would like to open the question and answer session. And I was looking at the question and answer window, as well as a few of my colleagues, they have shared their questions directly with me. So I'll try that we try to answer most of these. So the first question I would like to ask, maybe I would like to ask Dr. Babar for this particular question. The concept is gaining popularity. The clinical trials should promote equitable access for diverse populations and consider gender, age, race, geographical, regional diversity as well to ensure findings are broadly applicable. Still, many countries or large populations remain underrepresented, and we see that Pakistan, being fifth most country, is still underrepresented. What is the role of regulatory frameworks in increasing the attractiveness of international collaborations and sponsors? And keeping this in mind, how would you rate the situation of Pakistan? And while I hand it over to you, I would like to read one comment from the from one of our attendees around that topic. And this is Aska Jaffrey, and she has commented similarly and shared her thoughts. It is pretty understandable that Pakistan has high potential to conduct clinical research. However, Pakistan's regulatory framework for clinical trials is less mature and less well known internationally. Limited transparency and lack of robust enforcement mechanism may discourage foreign researchers. So I've read out this comment from Aska, and I've put forward the question as well. And over to you, Dr. Babar.
Well, I mean, if we talk about this same problem, a lot of people, whenever we conduct any conferences or meet with the people, this is a common thing which people do present. But my observation is really different, honestly speaking. Let me quote you here that, I mean, I checked, being a WHO consultant, we requested WHO to call DRAP and call all the people from the relevant people from Pakistan to exactly see and analyze what is making clinical trials, not grow the way it can grow. And DRAP was very much there too. And I saw the openness in the DRAP, honestly speaking. And their director of clinical research, I mean, director of pharmacy, he was open to any criticism, and he was open and he was responding to those criticism. I tell you, the governance is an issue in Pakistan, no matter whatever you're governing. You know that, and we all know that. But I mean, I'm seeing a subtle and positive change in the. Yesterday, I spent 4 hours at the DRAP office, and I met all their team members, key team members, and I saw a very positive attitude. Let me quote you a couple of examples. That this previously, what actually happened, people in the government, when whoever is having a regulatory authority, they have red pens in their hand, and they just try to use that red pen as and when required. So the mindset is to criticize and critically assess things. Here, I'm seeing the change in the mindset. And I'm seeing that enabling approach, We have the example of Philippines and we have the example of Malaysia. I mean, CRM, Clinical Research Malaysia, is a very, very good example where hand holding is taking place. The regulatory authority is holding hands of the clinical trial sites and building the capacity, training people, providing them with the material and every support. So this is what I'm seeing, at least to the key people, that they are now realizing that their performance would be assessed by more and more and better trials happening here rather than stopping the trial from happening. Time was a crucial thing that, I mean, all the sponsors do take this in consideration, that if the approvals from by the two relevant committees, the National Bioethics Committee and the Clinical Trial Committee of the DRAP, is taking 3, 4, 5 months. Now they have made it a concomitant application. Both applications can go together, and you can track it as well, that what is the current status. And yesterday, the relevant director was telling me that if needed, we do publish the calendar of the meetings. But if needed, if we have lots of applications, we may have additional meetings too to sort that thing out. So yes, it was a problem. It is getting better. The tangent, the trajectory is towards improvement. And I'm seeing the transparency part as well, and in DRAP, because the real time reporting of the AEs and SAEs and those kind of things, that is happening. So when things are transparent, the accountability comes automatically and things improve automatically. And at the top, I'm seeing a good positive attitude. Yes, it was past when there was a lot of time, wasted in getting the trials, approved from the regulatory authority, but it's changing. And I hope and I pray, and we would love to, in upcoming conference, the second day of the conference is very much about all these things. One day is about the day one is about the applied and the clinical and the academic components and concepts, but second day would be addressing how we can sort these things out. And we anticipate to develop a good recommendation paper after that conference and the symposium, and submit it to the ministry and the DRAP and everybody. So things are getting better. That's my conclusion of this comment.
Thank you so much, Dr. Babar. So this is heartening to know, and from your real life examples that you have just quoted, that things are getting better. And just for the audience who might have joined us slightly late, or who do not know that in February, Pakistan is holding Pakistan Clinical Trial Summit 2025, and in that particular event, DRAP is supporting that event as well. So, and Dr. Babar Khan was actually referring to that event. So we're looking forward to that event, and we're looking forward that all the stakeholders, it would be a good opportunity to interact with each other, to start a dialogue. And as Dr. Babar Khan, we are looking forward to a call of action or a set of recommendation coming out of that clinical trial summit. So thank you, Dr. Babar. And I have noticed, Dr. Sadiq, you have already covered that while you covered the clinical trial attractiveness index. So that was very interesting. And at least I have come to know about this tool for the first time. So how do you see what were the findings of the report for that particular metrics while you were doing all that landscape review for Pakistan? So can you share your thoughts on that?
So I think, this was just using this matrix when the criteria, and I was just reading the report last night. There was an exhaustive list, and I just gave the examples from some. And, I touched on that, like, patient participation, cost and affordability. I also want to highlight the point that when your economic condition is unstable, you're gonna less attract foreign funders or foreign people to invest into the trials. And also, there's a lot of uncertainty that can happen. So it was like 5 or 6 pages, but a lot of it. What I noticed was that a lot of things that were strengths, they were also sort of opportunities for improvement at that time too. So for example, when it came to the workforce, we do have workforce, and if you talk to the young people, they want to do research, but they don't find the mentorship that we can provide. So one area that we can work on how to hold hands and move forward with that and develop that skill set. So one thing, and I have shared the links. I will urge you guys to read the report. It was exhaustive, but still it's only 45 pages report. So I will stop here.
Right. Thank you so much, Dr. Sadiq. So the next question I would like to ask Dr. Ayesha. So Dr. Ayesha, considering that you are a PhD in MPhil supervisor and you're a principal of a postgraduate medical institute as well. So it seems that we have a good participation from students' body. And there are some students who are sharing some of the challenges that they are facing. So, for example, there is a student, I'm hoping that I am calling her name right. I believe it is Kainath, and she has pointed out that towards the problems that students face in countries like Pakistan whenever they are pursuing research. So she has pointed out towards lack of equipment, lack of chemicals, and pretty much because of lack of funds and the facilities at the institutions where they are based. So that is quite discouraging for the students, and that limits them to deliver and to pursue their passion for research. And on a similar note, there was a question, I'm missing the name now, but one of the student was asking, like, when a student wants to pursue research as a career, so what is the advice for that, and what are the possible career paths? So I would like to hear that. I've actually merged two questions for you. So over to you, Dr. Aisha.
Well, thank you, Farah. So can I comment on the previous trap question? I just wanted to add one comment on that. That was very pertinent and very well explained by Dr. Babar about why we need a regulatory framework and we need regulatory bodies. But in addition to international regulatory body, we need trained IRBs as well. Our institutions, they don't have expertise, or their IRBs, they are not well trained to address the issues of equity, justice, beneficence and non-maleficence, which are the basic, the ethical principles. So from there, we can bring change. Ethical and quality grant or the clinical trial can be written and it can be executed. The questions which you asked, actually, undergrad students and the postgrad researchers, they are always asking for how they can get funding for their research. They don't actually have access to funding agencies. They don't know how to tap funding, how to approach funding agencies in their field. So it's the responsibility actually of the supervisor to guide them. And if the department is running projects and they are into grant writing, into clinical trial, international clinical trials, and they can offer students to participate in that. So in that way, we can build up their capacity, and appropriate skill mix is very important while we are developing teams, as suggested by Dr. Sadiq. And again, we learn from experience, so we should give chance to our juniors. I'm also director of CTU at Sheikh Zayed, and here we have actually created some post for junior researchers. They can work on honorary basis, or they can have their honorarium through the trials. And in that way, they can learn, they can have their electives over here, or they can, in a kind of internship, they can work over here and learn. And we are also planning to collaborate with CROs, where we can place our students and they can learn how a clinical trial is executed, how the sites are managed, and how the paperwork is done. So I think these are few suggestions for that, if it's okay, or something else you want to ask.
All right, Dr. Aisha, thank you so much.
So, can I go?
Yes,
So
please,
I
doctors.
just, I probably don't have as an explicit and comprehensive advice as Dr. Mayu did. I think for me, research or clinical medicine is not a sprint, is a marathon. And you will see as a student, you want to jump into the clinical trials and do all of those things, which is great. Even when I was in medical school, I didn't know what, clinical trials mean, or you can imagine doing this in Pakistan. So I appreciate the enthusiasm, but at the same time, when I look at the US and I compare to countries, there are not many funding opportunities for students, even in the US. There are some represent, medical organizations such as in psychiatry, APA, and ACAP, American Academy of Child and Adolescent Psychiatry, will give small funding to the students, but they don't give an exhaustive funding. So what I will urge you is you start with what's in your control and what you can do, right? So doing simple observational studies, case reports, that's where you can start from. And you don't have to publish your first study in JAMA. You can start with little and keep building on that. That's what I've learned in last 10 years. But along the way, you will find, really enthusiastic mentors who can keep bring you under your fold and who can guide you. And please don't shy away from reaching out to the supervisors. Most people who are in some sort of work, they care about that work, they want to help you. So just, find people who is in your institution who's doing any sort of research work, reach out to them and see if you can participate with them. So start with little, but there is a saying that someone said, yeah, reach for stars in the sky while you keep your foot on the ground.
Thank you, Dr. Sadeh. So, a very good piece of advice. Maybe start with something simple, and we appreciate the problems and the challenges that you face. So, research is again a slow process, and it takes a lot of patience as well. So, thank you for that. So, we have like left with last 6 minutes. I'll try to cover I tried to cover all the questions, but I would like to assure the attendees and the participants, if there are any questions that would be left unanswered today, we would reach out to you and like the written answers via email. We'll try to do that. So I'm reading out a question from one of our participants, and and this is open for all the panelists, and I would like to see who would like to answer this. So the question is, how can we work toward decolonizing public and clinical health research? What strategies would you recommend to promote equity in public and clinical health research between high-income countries and low and middle-income countries? Additionally, could you kindly share any existing initiatives aimed at decolonizing public health? So I think I'm missing the name of the person who has asked this question. So do we have any panelists who would like to go forward with this question, to answer this question?
Well, go ahead, Ayesha. Go ahead, please.
I think I answered to this question in the chat, in the question and answer portion. Actually, I was talking about 1090 gap. There is definitely a gap where 90% problems exist. There only 10% expenditure or research budget is spent. So to bridge this gap, internationally, there are many measures being taken, like we have open access journals, and we have grants for low and middle income countries. We have subscription free, or you can say the full fee waiver option in while submitting our results or our published for publishing or are submitting our manuscript. So in that way, we have many opportunities to bridge this gap, but definitely we need to make efforts at national level as well, not just looking at the international community. We need to put our foot down and start working on building capacities and training our researchers on grant writing. That is also very important, how to ask for budget and how to get waivers. So I think this is from my side. Any other comment, please? Thank you.
And adding on to what Aisha just said, I mean, I tell you, the buzzword is culture. I mean, if we can inculcate the culture of research, and proactivity rather than reactivity, and doing whatever meager you can. We say that a journey of 1,000 miles started the first step. Don't wait for things to happen, make things happen. That is what is required. And that culture basically is going to change the scenario. I tell you, I'm seeing lots of activities, sporadic activities in Pakistan. Let me quote here that in last 3 months, 4 major events of clinical research are happening. But the thing is that, I mean, if all these efforts are combined, if all these efforts are getting, synergized with each other, that is for sure going to play some really good role. And important thing is that, I mean, research to publication. जंगल में मोर नाचा किसने देखा? I mean, if somebody is doing research and we are unable to publish that, I mean, that is nobody knows what's happening. And then this is happening when I'm talking to my connections, international connections. They say, hey, you don't have electricity in your country. You don't have people who probably can do the job. I said, where are you living? They don't know, honestly speaking, that what kind of, good services we can offer. So the CDSP, the Clinical Trial Summit of Pakistan, is expected to be the game changer here now. We will be sharing the findings, and we'll be sharing the efforts made by all those people to the whole stakeholders of the international stakeholders, the CROs, the sponsors, and everybody. And things are going to change, inshallah. The leadership which is sitting here and at many places, they are working hard. For I appreciate the way you are handling things here. And the same goes in the Peshawar. Nasir is doing good job. In Karachi, Hamid and Saeed Hamid and Sadi and I mean, there's some good people. Ayesha is doing a great job in Lahore. So we do have these islands, small islands. These islands needs to coalesce and make, something really, I mean, a kind of a holistic picture. Be optimistic and follow the system and process. There's no shortcut for research. You have to follow the system and process. That is important.
Thank you, sir. Thank you very much, Dr. Babar and Dr. Aisha. It was a difficult question, but handled very well. So with this, I would like to inform everyone that we have been joined by Dr. Sarfaraz Hasni, and I would like to invite him to say a few words and introduce himself and say a few words. So over to you, Dr. Sarfaraz Hasni.
Okay, Assalamu alaikum everyone. So this is kind of unexpected, but thank you so much. I think it's a good topic, and I've been listening to the discussion. So I primarily work at the National Institutes of Health in Bethesda, Maryland, in USA, and my focus of research is in autoimmune diseases and primarily focus on lupus. And I think the last point that Dr. Babar was saying, I would echo that there are no shortcuts. So one of the biggest thing I would see in terms of impediment to focusing on research and growing in the research sphere is to have the necessary skills. So just like anything else you learn in medicine, for example, you are an internist and you would like to be a cardiologist. The same thing is that if you are an internist and you would like to do clinical research, there is a specific set of skills that you need. And that is one of the major issues that I get a lot of inquiries about people who would like to join research, but my always come back to them is get those skills, acquire those specific knowledge, and then venture into that, rather than thinking that, okay, I can do something like this on the fly, which is a lot of time what I see. So there are a number of courses, there are a number of things that are available freely online now, and very good quality educational material that you can do it online on demand. So and it's mostly free. So my recommendation would be to please get those skills and then try to focus. So the other thing, very important in research, is having a focus. Not when you look at the CV and somebody has done research in pulmonology, and then the next paper is in ID, the third one is in psychiatry. That just tells the person who's looking at the CV saying, okay, so this person is just randomly doing things and have no focus. So two things is to acquire skills, and number two is to be focused. Thank you so much.
Thank you, Dr. Sarfaraz, for joining and sharing your thoughts with us. So very well said. So I won't be speaking too much right now. So how about we have almost used our time, allocated time. So I would like to go like to all of my panelists to have their final concluding remarks, and maybe if they can just it would be just good if they're precise, like 1 minute each of you. So how about we start with Dr. Ayesha? You go first.
Yeah, thank you. And thank you very much, Farah, Louis, and Sylvia, for organizing such a wonderful webinar. And I think we have we have maximally utilized the allocated time. So very well done, and thank you so much.
Thank you, Ayesha. Dr. Sadiq, would you like to share some of your thoughts, concluding remarks?
Yeah, I think I agree with what Dr. Hassani said and Dr. Khan said, which has been said multiple times, but I think we don't hold it closer to us, like journey of 1,000 miles always start with one step. So I see in the participants and attendees, there are a lot of young folks who are starting their journey. So start with little. When you wake up tomorrow in the morning, think about what you can do right now. In psychiatry, we say a circle of control and what you can control and what you cannot control. Start with what you can do right now and go from there. If for some people, they have expressed their interest in developing statistical analysis skills. So if you're interested, we have an Merit Academy website where we, just did a course that ended a couple of months ago on data analysis. It is beginner oriented. If you're interested, please send an email to Upna Merit, and we'll waive off the fee for people who are listening. Just share that you attended the session and you're very much into research and you want to get started. But also, Coursera has a lot of courses. One thing that I tell people is that there are a lot of resources that are available, but a certificate is worth the paper if you don't put it into the use. So you can do as many as courses as you want, but if you are not able to translate into a paper or a product, then that certificate is just a piece of paper.
And Dr. Babar, please concluding remarks.
Well, Farah, congratulations for sure. I mean, great job. I was seeing the kind of probably 50, 60 messages to prepare to get, ready with the mock and everything. Commendable job by Louis and Sylvia and then Farah. Thank you for that. My message, because we are the old people who are just leaving the places, and you guys are going to occupy those places. I feel that don't complain. I mean, people do see things which are negative. Please, I mean, look at the common denominators and don't complain. Do whatever you can in your best capacity, and then uh, be proactive. Don't wait for things to happen. Play your own role, your own role, and then try to develop the culture. And as twice said, but I would repeat that there's no shortcut. No shortcut. You have to be very, very system oriented and process oriented. Clinical research is not a joke. That is something which requires a lot of focus, a lot of detail orientation, and a lot of detailed work. You have to go into it. Be an inquisitive learner. So this is what basically my message is for all the audience, and for me also to learn and then continue learning. And thank you very much.
Thank you. Thank you so much. So thanks for the concluding remarks from all of my panelists. So I would like to extend my thanks to all the panelists and all the attendees. It's an odd time, it's winter already. So thank you very much, all the participants for the active participation. I would like to say a big thank you to Louis and Salvia and the Global Health Network. So on the screen, you can see the QR code to become a member of TGHN Pakistan Hub. So I encourage you to join Pakistan Hub. It's our hub, it's your hub. And here we can find opportunities to interact on regular basis and find opportunities of developing synergies. And the Global Health Network Training Center has a wealth of courses which are freely available, and it's a very good collection as well. So this is an upcoming workshop that that is primarily part of the Clinical Trial Summit Pakistan 2025. That is primarily primarily organized by Aga Khan University and National University of Medical Sciences. Dr. Babar Khan is one of the organizers. He's with us, and with his support, me and Dr. Ayesha Humayun, we have put together a workshop, in-person workshop to be organized at Shaukat Khanum Memorial Cancer Hospital in Lahore. But of course, that is in collaboration with the Institute of Dr. Ayesha Humayun. It's in collaboration with Postgraduate Medical Institute at Sheikh Syed. So you can see the QR code to register for this as well. And I would not hold you for too long. I would like to thank all my attendees, all my speakers, and my supporting team at TGHN. Thank you, and we would end the webinar here. Thank you. Assalamu alaikum. Take very good care of yourself.
Thank you. Assalamu alaikum.
Thank you.
Thank you so much.
Thank you.